Dr. David Nabarro. He is the WHO's special envoy for COVID-19. He's joining us from Geneva. Dr. Nabarro, thanks very much for being with us. If I could ask you very simply, how is India doing? We've been in lockdown for 56 days, easing a bit now. We had hoped to flatten the curve, but the cases are only rising. So does that mean the lockdown did not work, or that it helped prevent a much larger outbreak?
Thank you very much indeed. This virus spreads really rapidly, and it does go quickly into new populations if movement is not prevented. So the government imposed an early lockdown to try to prevent the virus from arriving in parts of the country that so far have not encountered it. And what I'm seeing is two things. First of all, that the rate at which the virus is spreading seems to be slowing, in that the doubling time for cases is quite longer than it normally would be. Secondly, I'm seeing that the virus is being confined in a number of clearly defined areas, pretty much in the concentrated urban populations, for example, Mumbai, Gujarat, New Delhi, Chennai and other similar locations. That's a good sign that the task now is to continue containing the virus there, preventing its spread to other places, and then also making sure that people suffer as little as possible from the effects of the lockdown. I appreciate that it's taking time to really reduce the number of cases, and that's because in a densely populated area, it's really hard to reduce transmission through case finding, contact tracing and isolation. But I would say, please keep it up, please keep going. You will release the lockdown bit by bit, as you've just said. And as you do so, please keep making certain that everybody does what they can to prevent the virus continuing to transmit between people.
Dr. Nabarro, the Indian government's data today shows that India went from 100 to 100,000 cases in a matter of 64 days, which is much slower than other countries who've had a high caseload, say like the US, which went to the same number in 25 days, or the UK, which did that in 42 days. How important is this? Because India's testing rates are still very, very low as compared to these other countries. So how should we look at this data?
Well, first of all, you're right that the testing rate might be lower compared to other countries, but there's a very important statistic, and that is the percentage of positive tests that are being found. And in India, that's been, in my most recent study, I'm not fully up to date, around 4 to 6% in most locations. And that's good, because it means that although perhaps you're not testing as many as other countries are, you're still testing in a way that means that you're keeping a very good eye on where the virus is. Secondly, this doubling time, the increased doubling time, and what you described, the special number of how quickly you go from 100 to the higher number, as you say, is slower in India than in the US and the UK. Another very good sign. It's just a case of keeping it up, because you've got to continue that effort to try to make certain that you go on preventing this virus from being transmitted. You know, I watch what you're doing in India as closely as I can, and I continue to be massively impressed, because all the evidence that we have tells us that in densely populated urban areas, it's particularly difficult to suppress outbreaks. And that's why, although you're seeing the increasing numbers, that you should not be very worried. You should simply be saying you are showing the world how to deal with COVID when it is in these tightly and dense settlement areas.
So in a sense, what you're saying is that the rising number of cases should not worry us beyond a point, and also should India be testing more?
Well, of course, the more people you test, the more you're able to know where the virus is. But I have to be very precise with everybody, and I've said it before, but I want to say it again. This is not an easy test to do. You need to have a sophisticated laboratory with a lot of very well controlled circumstances in terms of the power and the water. You need to have skilled technicians doing the work. And so simply expanding testing to go to many more parts of the country and taking it into, for example, rural areas with less good quality support services is difficult. I'm actually really impressed with the speed at which testing has been expanded in India. I'm also impressed with one other thing, and that is the contact tracing that is being done, because all the evidence is that it's not just finding the people who've got the disease and isolating them, it's also finding their contacts and isolating them. Perhaps the toughest part is what you do when you found a person who's got disease who is a contact. Do you ask them to isolate at home, or do you take them to special quarantine facilities? I understand that this is a tough thing to do because people don't like being moved out of their homes, and I've been looking at the blend between external quarantine and home-based quarantine, and I think that again you've got that right. Though wherever possible, if you can enable people to go somewhere else to be in quarantine and in isolation, that does make it easier to restrict transmission. Generally, very good marks. Please keep it going.
So are you saying that India's testing is adequate?
I don't ever like to use words like adequate or not adequate, because of course the more testing you can do, the easier it is to be ahead of the virus. I would say that the important thing is to test as widely as you can, whilst at the same time maintaining good quality control on testing to minimize the number of false negatives in particular. And I would really like to give credit to authorities at the district level, state level, and at the central level for the way in which they've been able to ramp up testing whilst at the same time doing everything they can to get quality control. One other point is that if you do put a lot of resources into testing for COVID, you're taking resources away from other essential health services, tuberculosis control, for example, or provision of healthcare for mothers and children. And I understand that all the time authorities are having to find a balance between focusing on COVID and focusing on healthcare for other needs.
India's death rate is also low at just over 3%. How important is this figure, Dr. Nabarro? Because India seems to be doing pretty okay on that front under the circumstances.
I've seen some situations where the death rate is much higher. That may be because the testing is not done on such a widespread basis. It's only being done on people with extreme symptoms. Or it may be because the healthcare facilities are just not able to respond to the need of people with COVID. Perhaps people aren't coming in for healthcare early enough. I'm very pleased to see that your death rate is, as you've said, hovering between 2, 3, 4%. It's a good sign. And I want to add that we must remember that COVID is a disease that is dangerous. Never be deceived to think this is a mild virus that we can take lightly. It does affect people of all ages, particularly older people, particularly people with diabetes or with cardiovascular disease like hypertension. And so, yes, you're doing well. And one other thing is that as far as I can tell, your infection rate amongst health workers, although it's there, is not astronomically high, which means that the protection of health workers from the virus is being practiced to good effect. Altogether, doing well, but please bear in mind that all this effort on COVID does take health workers away from other functions, and the lockdown is, of course, having a terrible impact on people's economic lives, and in particular, it's affecting whether or not they can get food and avoid hunger and malnutrition.
Finally, Dr. Nabarro, what about hopes for a vaccine? We had the report yesterday that Moderna is making progress in its human trials in the United States. Would you agree with President Trump's statement that a vaccine could come by the end of this year?
Well, I do know that developing a vaccine is not an easy task, especially for a coronavirus. People say that they're quite difficult candidates for a vaccine, this particular group of viruses. I also know that once you've got what looks like a good vaccine, you have to go through various stages to make sure they are fit for widespread administration to people. once you've found that a vaccine works in animals and then in human volunteers, as the Moderna team have shown in the US, you then do have to go through a series of trials in human populations to check, for example, that there are no side effects from the vaccine, and also to check that it really does give protection. We'll need to wait a bit until those trials are done. Usually that takes about a year, perhaps even 18 months. So any prediction that we can go much quicker than that means that there's been some way found to speed up the trials. And my only concern is that not every country will accept trials that are done rapidly, because they want to do everything possible to make sure the vaccine is safe for their people. The one thing one doesn't want is to have a vaccine with side effects that perhaps leads to people dying. Then that will result in people refusing to be vaccinated, and that will not solve the problem. So let's watch and see how the Moderna experience develops. Let's make sure that the efficacy and safety trials are done fully. And then let's see how countries then take the results and decide whether they're going to license the vaccine for use. Last point is really to make certain that the vaccine is available for everybody. It would be really wrong if the vaccine could only go to certain populations based on wealth or based on nationality. As somebody in the World Health Organization's team, I want to be sure that everybody can access the vaccine, especially people who are most exposed.
Dr. David Nabarro, the WHO's Special Envoy on COVID-19, thank you very much for joining us on NDTV today.